speak to you guys today about the coronavirus that's spreading through the land. There's another doctor amongst us actually who I asked if he could join us as well. Two guys are better than one, and I certainly can't address everything. So if I miss something, if I don't get it, this is Brother Fuzzle. Come on over. We're both optometrists, we're eye doctors in this community. MashaAllah, what the Sheikh was saying, I mean, our health professional degrees, they're only worldly. What comes from Allah, comes from Allah. So truly, we've experienced this right now being here, and we know that there are many masajids that cancel the prayer and things of that nature, but today we're here not because we're fearing this coronavirus, but because we want to worship Allah. And that really is our purpose in this dunya. So with that, keeping that at the forefront, what do we know about the coronavirus? Coronavirus actually existed well before we all started to know about the word coronavirus. And I also want to point out one other thing. If there's any other physicians amongst our community and you'd like to come up and say something, you're more than welcome to. So coronavirus did exist prior to its. This particular strain of the virus is something that we haven't seen before. So our job now is to really figure out, what is in the medical community, why is this happening, and what would be the cure for this. And with any kind of pandemic, which is a outbreak globally of a disease, as opposed to an endemic, which is contained locally or in a smaller scale, how could we address this, and how do we get the right tools to fight this disease? For now, the CDC is probably the best source to learn about this disease, the Center for Disease Control, where they've listed things that you're looking out for in the community, what symptoms the disease could cause, and ways of prevention of minimizing risk for that disease to get to yourself. With that being said, though, things that are bound to happen to you, what Allah has written, will happen. There's no way around that. But we can do what we can in order to avoid spread and contamination within ourselves. I want Brother Fuzzle, if you can, to go over a few of the things that, symptoms, and if you'd like to do that.
Assalamu alaikum warahmatullahi wabarakatuh. Alhamdulillah, I of course agree with the Imam and Brother Omar. Everything is a decree of Allah subhanahu wa ta'ala, and something that we're bound to get. If it's in the will of Allah, we're going to get. And something that we're never bound to get, doesn't matter how crowded the gathering is, we're not going to get it. Part of Islam is to understand that everything is from Allah and He's the best of planners. But at the same time, our deen teaches us to tie the camel, and what can we do to educate ourselves and prevent the spread of this coronavirus. So just like Brother Omar said, this is something that has been around, and there's been different strands, but this strand is a little bit novel. It's very mutacious. It does change a lot, and the origin, as you know, is from Wuhan, which is a city in China. And one of the reasons why it originated from there is because that area has a lot of wet markets, so there's a lot of live animals, and the animals, the way they're caged by design, they're stacked upon each other. So you could have a bat, you could have a monkey underneath it, and you could have some other sort of animal all stacked upon each other, and then the bodily fluids and excretions, whether it's urine or feces, trickles down from one animal to the other, and a lot of these information from all these different animals kind of creates like a very deadly cocktail in which a virus can emerge from. So a virus by nature is something that is not alive. It is a strand of DNA. And this particular coronavirus is something that affects our respiratory system. And one of the problems with this virus, although the mortality rate is only 2%, which is, if you do it by 8 billion people, that's about 112 million people that can potentially fatally pass away from this virus. Although the mortality rate is very low, one of the problems with this virus is the incubation period is very long. So someone who may have the virus may have it for 5 days without any sort of symptoms, and that's what's the deadly part about this virus. You could have the virus for a long time and not know it, and you could be spreading it amongst your family and friends, and then after about 5 days or so, you can get upper respiratory issues, cold-like symptoms. After that, about day 7, you can get a fever and that sort of thing. So, and then about day 14, you can have shortness of breath. So, about 20% of people out of everyone who's going to be affected may have to be hospitalized, and that's one of the problems. 20% is a large number, and the amount of hospital capacity we have is very limited. So the best thing to do is to prevent the spread of the virus. And one of the things, obviously, from our sunnah, we wash our hands. That's number one. But also to keep our distance from a person that we know is affected. Also to keep yourself quarantine if you know you're sick as well. To do the best that we can. Obviously, one of the dangers is that mass hysteria and people are getting overly worried, and the shopping shelves are completely empty. So what you want to do is you want to have preparedness before. Make sure you have at least 2 weeks of food. That's us tying the camel, and shop early rather than later, because later, if you think the supermarkets are chaotic now, it's only going to get worse. But number one thing, just like the Imam shared with us, is dua. I'm talking to myself first. We do what we can, but we leave everything in the hands of Allah subhanahu wa ta'ala, and we just pray for the best. And just like what the Imam said, that worst case scenario, we do end up passing the virus, then inshallah may Allah accept us as martyrs, inshallah.
A couple of quick takeaway points from this. Number one, the incubation phase of the virus means how long can it be in your body before it actually starts showing symptoms. That's important to understand. It could be anywhere between 2 to 14 days. So you could have it for 14 days and not know that it's there. That's number one. Number two, understand the symptoms, meaning how does it show? Keep these in mind. Fever, shortness of breath, and flu-like symptoms. So if you're getting these kinds of symptoms at all, if you're around someone who's getting symptoms like this, maybe let them know, hey, it's better to see your primary care doctor, or call them at least to talk about that. And then finally, keep those symptoms in mind. And then one other thing before I let Dr. Qureshi take over, one other thing I want to mention is hygiene. It is very important. Keeping yourself clean, disinfected, and washing your hands regularly, using antibacterial regularly is very important. When you cough and sneeze, right, there's 2 things the CDC recommends. Either pick up a little tissue paper and cough into that, throw it away immediately, or the other way to do it is in the elbow, inside of the elbow. You don't want to openly cough and sneeze so that this virus can travel across. The primary way it'll get into your system is respiratory, meaning breathe in or breathe in, right? So try to avoid that. And then one last thing I want to mention regarding what we can do to help each other around us. This whole coronavirus thing has a big stigma with it, right? If you go on the CDC website, it's got this entire section of what we should do when we communicate about this to other people. So let's not, as a community, isolate other groups of people. We shouldn't look at someone and say, oh, this person is likely to have it, that person is likely to have it. Rather, we should educate and prevent ourselves from becoming a vector for spreading it. And the other big and very important point is, if you can, and if you're able to, check and see who doesn't have supplies for proper disinfection. If you can, this is a way of sadaqah for you as well, to give what you have, from what you have. It doesn't have to be monetary, it could be things to do regular cleanup with. The masjid, inshallah, I think should be wiping down and sterilizing door handles and things like that. But I'm going to let Dr. Qureshi take over. I think he's probably a more prominent figure to talk about this,
Thank you. Most of the stuff has been covered by the other 2 doctors. I just wanted to let you know I'm Dr. Nisar Qureshi. I'm part of faculty group practice in NYU and Department of Medicine, and I live in this area for many years. This disease is very prominent. There have been other diseases like this, like SARS and MERS, but this is more prominent because it is very contagious, and you have to be very careful. Anybody who spits or coughs or sneezes, within 6 feet you can get it. So you have to be away, at least 6 feet away. If possible, you can avoid crowds so that you never know who has it and who doesn't have it. More important thing we want to emphasize to our community, that if you are sick, please stay home. even if it's a mild cold, you never know what it is. So stay home. Don't give people a chance that, may God forbid, you contracted it from somewhere, and you don't want to give it to the whole community and bring bad name to the community. And then we'll be in the newspaper all over the world. And we don't want that kind of negative publicity. The other thing is that, of course, use your hands as often as you mentioned. Wash your hands as often as you can. Use soap, preferably liquid soap. In the family also, if somebody's sick, don't use same cake soap. Use liquid soap if possible. And other places use hand sanitizer, which should have at least 60% alcohol. And of course, the management is doing whatever they can to keep the knobs, door knobs, faucets, and all these things clean with at least 70% alcohol solutions or some detergents which are generally available in supermarkets. They should work. Among other things, if you have any questions, I would be more than pleased to answer any specific questions. I think we have covered most of the stuff.
جزاك الله.
طيب